Thank you, Kristen. Next slide. Greetings, everyone. My name is Karina Limerick, and I am the program manager for the Health Equity and Racial Justice Office. And on behalf of Anne Arundel County Department of Health's senior leadership and the team members of the Health Equity and Racial Justice Office, I'd like to warmly welcome you to this month's Health Equity Forum. We have an exciting agenda for you today. And with that said, we would like to hear from you. We'd like your feedback. And so if you have questions or comments, feel free to type them into the chat feature or use the raise your hand feature in Zoom. If you're joining us in person, feel free to share your verbal feedback. We would like to hear from you throughout today's forum. So during today's forum, we acknowledge both National Minority Health Month and National Fair Housing Month. The first presentation will spotlight the passage of the Fair Housing Act of 1968 for reflection on housing discrimination and segregation, past and present. Then during the next presentation, our Department of Health's Childhood Asthma and Lead program will discuss asthma, a common disease on the rise with significant health disparities and associated healthcare costs, as well as the impact of lead exposure. These public health issues are connected to the homes in which we live and the communities that surround them. The presentations highlight that everyone should have the right to live in quality housing amid thriving neighborhoods with access to resources and relationships to help them achieve their best health. The final presentation centers on Healthy Anne Arundel Coalition to give us a glimpse into next month's celebration of Mental Health Awareness Month. Next slide, please. So this year, the theme of National Minority Health Month is Better Health Through Better Understanding. It's all about raising awareness of health literacy, health communication, as well as language access, all of which are important in helping to advance health equity. So I encourage you to visit the Federal Office of Minority Health to check out more information on how you can join the Office of Minority Health's efforts in amplifying this message. For those of you who work in a capacity through county government, I'm thrilled to share that last week, the Office of Equity, Diversity, and Inclusion updated the Ask Anne pages with new language access resources. So you'll want to check that out for more information and resources on how you can help to put in place a language access plan and how you can support health literacy and health communication. Next slide, please. So last month, our health department and the county at large officially said goodbye to Dr. Kaliana Raman. He now serves as the Deputy Health Secretary for Public Health Services. And the HERJ office remains grateful for Dr. Kaliana Raman's tireless public health leadership, as well as his steadfast commitment to health equity. We're also more than thrilled that he passed the baton to a strong public health leader and champion for removing barriers to care and creating systems that advance health equity. Next slide, please. So while she's no stranger to any of us, it's an incredible honor to introduce you to the Anne Arundel County Department of Health's new acting health officer, Dr. Tony Gedden. Dr. Gedden will be joined by Jennifer Snyder, the director of the Health Department's Bureau of Disease Prevention and Management, and they'll provide a joint update on the Healthy Communities program. Dr. Gedden.
Hi, good to see you all. As Karina said, not a stranger to this group, but it will just kind of change what I'm saying during the meeting a little bit. And we're actually going to change our format this month, and we're really excited to not kind of start with communicable diseases the way that we have every meeting since this kicked off, right? We would start with here's a COVID update, and we switched into MPOX and COVID. And so I think we've hit a place where we want to make sure you still have the relevant information. If there are things that we should be pushing out to you, still encouraging folks to get their bivalent booster if they have not, but that update has morphed a little bit. And so what does that look like now? We can move to the next slide. Looking at the Healthy Communities Program, which is specifically kind of birthed out of everything that happened during the pandemic. So looking at better ways to provide access to services, better ways to interface with the community, better ways to partner with other organizations and residents. And so this Healthy Communities Program, some of you have attended different kind of open houses for people to learn about what this looks like and the work that we do. Came out of the pandemic. And so we wanted to make sure if you couldn't make it to any of those events that you were able to actually hear a little bit about what this program is offering, why it's now in existence, and who we're trying to serve with this program. And so what it really is health disparities have long been in existence. The pandemic shined a very bright light on some of them and how stark they can be. And so we created some new ways of working. And we don't want to go back to 2019 and what did the health department look like then, right? We learned a lot and we want to use that information to move us forward to continue to try to work to reduce health disparities in the county. And so how do we do that? We learned tremendous amount. There are a number of you here that are working with us to do just that. And so we want to acknowledge both the Healthy Communities Program, the Health Ambassadors, which also came out of that work, and will continue. So I'm going to hand it over to Jen to talk a little bit more about the specifics of what they do, and how they do it. And we've also got a little video clip to lead in. You want to do video first?
I'll talk really quick. So just to follow up with what Tony had said, even though we don't have a communicable disease update, we still learned a lot through COVID, and we don't want to, just like she said, we don't want to go backwards. We learned that we needed to go to the communities. We needed to go to communities rather than have them come here or come to us. And so one of the things that this program allowed us to do was to provide mobile services to communities, to vulnerable communities. So we were able to take COVID vaccine, we were able to take back to school vaccines, that we were able to take flu vaccines and bring them to the communities to ensure that, our vulnerable populations are protected. We also were able to provide vaccines to our homebound residents. And this was really a group of folks that we didn't touch at all. And we found that this was really a need in the county. And so again, just these lessons that we learned, these important things that were uncovered, we just really want to continue. And it's not only our mobile services, we also, with this group, we want to increase the capacity at our health centers. So right now we have the Glen Burnie Health Center that's in Glen Burnie and the Pearl Health Center that's in Annapolis. We also have the Lula G. Scott Community Center in Shadyside. And we really want to expand our services at all three of the locations and expand our days, expand the public health services that we are offering. And again, this program will really allow us to do that. So I don't want to say too much because I tend to say the same things that I said in the video. So I'm just going to shoot to the video so I don't sound like a broken record. But this is just really shows what we did, who we interacted with, and not only in the Healthy Communities Program, but in the Community Health Ambassador Program as well. So that's important as well.
At this point, Leanne has been fully vaccinated, and I have as well. We got that courtesy of your office. My name is Richard Berman. My wife is Leanne Berman. We've been married, as I say, for over 60 years. Leanne had a stroke 4 years ago. My wife cannot travel without a major production. This service has been invaluable to us. It's the only way that my wife can get those vaccines and reach us. It's been wonderful to have that service.
And here to prevent or control whatever's going on. Be it COVID, monkeypox, trying to maintain it and get it out of control. Yeah, my name is Valencia Pinky. I'm a nurse at the Department of Health. One day I'm swabbing patients, the next that we're gonna be vaccinating people in their homes. Couple days later, we're in homeless shelter. We're in libraries and schools, and we go to community centers for the elders. Part of Anne Arundel County, I didn't even know it was that big.
We can't expect people to come to us for everything. We have to go out, provide those services. You know, the goal of the health department is to have public health. The good thing that I always say that came out of COVID was just the partnerships and the relationships that we built with the community. We really did a really great job of getting the pandemic under control, and we were able to those underserved communities, underserved population, to ensure that they had access to testing, that they had access to vaccines, and education. It was very easy for us when monkeypox started. We were able to very quickly switch gears and go to monkeypox. Well, we were really able to kind of expand and contract the programs and the services that we offer because we had this workforce. We could pull from testing, or we can add to testing and decrease vaccine. So just to really enable us to, you know, address what's coming. And we really don't know what's coming. This team allows us to respond very quickly to any kind of future infectious disease outbreaks that are to happen.
What we do is we go door to door to different neighborhoods all around the county. We have a short questionnaire of needs assessment that we do with the residents. And it's just a zip code to live in, make sure you live in the county, and just what your main needs are. And we just try to help you with those main needs as much as we can. It's rewarding that I'm able to help immigrant families get the information they need, for like financial assistance, food assistance, even like COVID related.
This is just another way to take it that extra step further to link people to services, provide them with education. We want to be able to do in the scale that we did without that workforce. Some incredible people that are so dedicated and passionate about the work.
We're doing good in Anne Arundel County, so I'm just proud to be a part of it.
So it's really beyond COVID now. We know that there's a need and we just want to continue. And if, you know, we're not able to sustain the program, all that's just going to go away. So that's really what the purpose of the open houses were, just to kind of get the information out to the community and just continue those partnerships and those relationships.
No, really just that our goals for the future are to look at different ways to utilize the staff, right? What are the different types of health conditions we can be focusing on? As Jen mentioned, every year there are back to school vaccines, every year there are flu vaccines, and those are just two ways that we can operationalize this program. And so we'll really be looking for ways to get into the community and what are the services that we can provide on a mobile basis. And having people have better access to what we do, even if there's not a health department building that happens to be close to you or easy for you to access. So more to come, and as we continue to develop out this work, we will definitely come back with updates for this group.
Thank you, Dr. Gettin. Thank you, Jennifer. Next slide, please. So this year, as I mentioned, we are commemorating the 55th anniversary of the Fair Housing Act, the passage of that act, which makes discrimination in housing transactions unlawful. And so I'm pleased to introduce to you Asha Smith, who is the Equal Opportunity and Human Relations Officer for our county. She's an attorney who provides strategic direction for the county's civil rights compliance activities. Ms. Smith started her legal career as a staff attorney in the Law Enforcement Bureau of the New York City Commission on Human Rights. After relocating to Maryland, she joined the Human Resources staff at Anne Arundel County Public Schools. She earned a Bachelor of Arts degree in government and a master's degree in public administration from Cornell University. She received her law degree from New York University School of Law, and she's a proud native New Yorker and resides in the Annapolis area. So pleased to have you.
Well, I am thrilled to be here. I'm always excited to be here at the health department because you guys do such amazing work. So today we're going to talk about fair housing, and I'm about to make a statement. I think it's going to be a tough sell in this room, But I believe that fair housing is the unsung social justice issue of our time. And I can see that there are people who might disagree. But housing affects every single aspect of our lives. Housing affects the quality of education that you get. It affects your opportunities economically. It affects how you fare in terms of your health and your welfare. Where you live, both the physical dwelling and your neighborhood are critical to basically where you end up in life. And so, as many of you know, even in Anne Arundel County, we are facing a critical, affordable health well, that too. Affordable housing crisis. I looked at some statistics recently, and I think the average rent in Anne Arundel County is about $1,900 now a month. We are an aging population. The wealth gap in this country and in our county is widening. And we have some things to think about in terms of where people are gonna live and how they're gonna live. And so for that reason, I'm thrilled to be here today. So I'm gonna start out with something, some of this stuff is not in my wheelhouse, so I'm gonna ask you to forgive me already. But I'm gonna start with the health wealth gap. That term was coined, I believe, by psychologists, probably about 10 years ago. It's a term that, thank you for the affirmation. Thank you. No, I appreciate it. So it's really a way of saying that there's a direct correlation between your wealth and your health. The wealthier you are, in all likelihood, the healthier you are, and vice versa. People with low socioeconomic status are more likely to have hypertension, obesity, infectious disease, mental illness, and injury or death from violence. And one of the critical factors for these health risks is where you live and how you live. Next slide, please. All right, we have been knee deep in social determinants of health. I think everyone knows what they are by now. They're non-medical factors that affect your health outcomes. There are a bunch of them. There seems to be some discrepancy as to exactly how many, but we know that they're essentially in 5 categories: economics, education, healthcare, neighborhood and built environment, and your social and community context. And all this is saying is that there are factors in each of these categories that determine how you're going to do health-wise. Housing is an identified social determinant of health. There's no controversy there. That's a fact. And it really straddles 2 of these domains: economics and neighborhood and built environment. Next slide, please. With respect to economics, your physical dwelling, meaning like your house, your actual apartment, your building, has an effect on how healthy you are. And how much money you have is directly correlated to that effect. If you are a person who has financial challenges, you're more likely to be cost burdened when it comes to your housing, and that means that you're paying more than 30% of your income on rent or your mortgage. If you're paying more than 50%, you're considered to be, there's a term for this, you're considered to be like significantly cost burdened. Like it's much, much worse, right? Like significantly worse. So what happens, and the way that this affects your health is that if you're cost burdened with respect to your rent, most of us know that a person on their last dime trying to secure their housing. That means that you don't have money for your prescription drugs necessarily. You don't necessarily have money for nutritious food. You're having to make some really rough decisions on a day-to-day basis. If you are having financial challenges, it's likely that you're having difficulty paying your rent. People who have challenges in terms of their health stability tend to be more likely to have mental health issues because it's a very significant, it's not a small problem, right? People with financial challenges are more likely to be in substandard housing. That means that they are exposed to health and safety risks. This is housing that is less safe. It's housing where maybe things are broken, where you find conditions as the health department. You guys know about this, you do the inspections, you know what you find there, right? Infestation of vermin, things that are likely to cause health challenges. And I know we're gonna be hearing some stuff about asthma in a little while, exposure to rat feces, roach feces, all of those things can create conditions. Overcrowding increases the likelihood that you're gonna get an infectious disease and spread it. Homelessness, frequent moves, all of these things affect your health, and they're directly correlated to the stability of your housing. Next slide, please. Similarly, the neighborhood that you live in affects your physical health. And once again, depending on how you're doing financially, that effect changes, right? If you have less money, you're more likely to live near environmental hazards, poor air quality, poor water quality, other kinds of risks. You're more likely to be exposed to high rates of violence, and that one is self-explanatory. You're looking at injury or death from violence. Isolation, social isolation has a significant impact on your mental health. And if you live in a neighborhood where you don't feel safe to go outside, where there's not green space, where you can't play, where you can't exercise, your health suffers for that. A lack of transportation that might keep you isolated in terms of the food that you have access to, the resources that you have access to, the jobs that you have access to. And then, of course, there's noise pollution. There have been a ton of studies. I'm not going to try to educate the Department of Health about health, but there have been lots of studies about how noise pollution affects your health. Next slide, please. So just to recap quickly, we know that there's a direct correlation between your health and your wealth. We know that poorer people tend to be less healthy. Several non-medical factors contribute to health outcomes. Where you live is a significant one. And people who are economically unstable are more likely to live in unsafe, unhealthy environments. So that's a quick recap. Now we're going to introduce another factor. Next slide, please. This is a graphical representation of the racial wealth gap. So what we're looking at on the y-axis is average household net worth. And then on the x-axis, we're looking over time. So this is over a 20-year or so time span. The top line, which is the blue one, the navy blue one, is the average household net worth for white Americans. You'll notice that it's the highest on the list, and it also trends upwards, significantly upwards during the last 20 years. I'm going to skip the next dotted line and go to the green dotted line. The green dotted line represents our Hispanic neighbors. You'll notice that it's significantly lower. I think we're at its peak, $200,000, maybe just a little above that. And you'll notice that they don't experience the same increase over time. And then below that, the red dotted line is African-American households. And so they are the lowest on the net worth, the average net worth scale. And you'll notice that they also are not experiencing the same increase. Now, you remember I skipped the second line. That's everybody else. So our Asian neighbors are going to be in that category. Some of our interracial households are going to be in that category. But you see that there is significant stratification, and it's by race. Next slide, please. I don't know how many of you have read The Color of Law. If you haven't, you should. If you are not a big reader, there is an amazing animated film that sort of summarizes the book, and it makes it very accessible. But Richard Rothstein is the author of the book, The Color of Law. He is an economist, he's an attorney. And one of the things that he says is that the wealth gap between white and Black Americans is almost entirely attributable to discriminatory federal housing policy implemented in the 20th century. And so you might be wondering, that's a big statement, and people will want evidence of that, right? And so I'm recommending you read the book, because I could literally be here all day talking about this, and Corinna is not having that today. So if we could go to the next slide. Really quickly, oh, this slide is still here. Is there another slide? That slide is still here too. Okay, so I made some edits. I'm gonna walk you through it myself. So in sum and substance, the federal government intervened heavily in the housing market in the 20th century. The federal government was a developer. They got into the business of developing housing to address significant housing shortages, especially during wartime. War industries were located in metropolitan centers that were becoming bigger and bigger. This is where people were helping to build things for war, and there was no housing there. And so the federal government got into the business of developing housing. The first thing that you should know is that the federal government initially did not allow African Americans to live in that housing. Once they did allow African Americans to live in the housing, they maintained segregation, and that was a policy decision. This was 100% legal. It was the policy of the federal government. So there was housing for white residents, housing for Black residents, and then they developed a policy of reflecting the neighborhood. So if the neighborhood was already integrated, they would develop integrated housing in a neighborhood. If it was still segregated, they would create Black housing in the Black neighborhood, white housing in the white neighborhood. And so the effect of that was basically to continue the pattern of segregation that had existed from the time of slavery, post-slavery, Reconstruction. In addition to that, the federal government got into the business of acting as a bank. And so they insured loans, FHA loans, right? They gave loans to developers to develop housing. They insured those loans, and they gave loans to people, private individuals, to buy housing, right? So they wanted everybody in a neighborhood. There's a lot to that. That's such a loaded thing. But the thing that's important for us is that they would not insure African American purchasers to buy their homes. So those loans to African Americans were not insured by the federal government. In addition to which, the federal government would not insure loans for developments where African Americans could buy homes. And so what you have is the federal government basically creating policy that affected where people live. There's more and more of this. We can talk about the War Guest Program, where the federal government paid homeowners, at the time, white homeowners, to house soldiers during the war. And then they also paid white homeowners to subdivide their homes so that they could house soldiers during the war. Black people were not getting any of this money. And so over time, what this did was to reinforce patterns of segregation in very substandard housing, in very substandard places. I just recommend reading the book for more. Next slide, please. Next slide after that. So the conclusions that we can make from what we know are that poverty, regardless of race, restricts people of lower socioeconomic status to less desirable neighborhoods and properties, right? Poverty on its own does that. Discrimination, regardless of income, restricts certain groups to less desirable neighborhoods and properties. Some racial groups are significantly poorer because of historical discrimination, and that's what we were just talking about. The money is not there in those communities, and the land is not there in the same way. And when you put all that together, poorer people in certain racial groups are more likely to be unhealthy and unsafe because they are restricted to communities and properties that are unhealthy and unsafe. And so it takes a little bit of analysis to get there, but we see the problem that we're facing. Next slide, please. How do we combat this? I would not give you problems without solutions. One of the great things that we have on our side is the law. And so federal, state, and local laws prohibit housing discrimination. Anne Arundel County has a law and has had a fair housing law since 2019, in case you didn't know that. These laws protect renters and homebuyers from discrimination. They say that you cannot discriminate against someone in housing based on any of those protected characteristics that are listed on the slide. I would like to bring your attention to source of income, which is in Maryland, a protected category, and in Anne Arundel County, a protected category. And that means that if you have a voucher, Section 8 voucher, if you got relief during the pandemic, a person or a housing provider cannot refuse to rent to you because of that voucher. Next slide, please. So the most common housing violations. The first one is the one that everybody knows about. It's just plain old refusal to deal. I'm not gonna rent to you, I'm not gonna sell to you, I'm not gonna negotiate with you because of your membership in one of these protected classes. The second one is a little bit more nuanced. I'm gonna rent to you or I'm gonna sell to you, but I'm gonna treat you differently than your similarly situated neighbor, right? So maybe you guys get to use the pool, but you guys don't get to use the pool. Or maybe you get to have 2 parking spaces, but I'm leery about your friends coming over, so you only get 1 parking space, right? And then the third is refusing to make reasonable accommodations or modifications for people with disabilities. This is key. And this happens more than any of us would care to admit. That's also very nuanced, and if you have questions about that, you should call me. Next slide, please. Historically, so it's very rare in 2023 that someone is going to say, I'm not renting to you because you're Black. Though there is the odd dullard that might do that, right? There is the random person who'll do that. But what you look for are the ways that people discriminate. So one classic is steering. I'm a landlord, I have properties in Severna Park, I have properties in Brooklyn, and I look at you and say, I make a decision that I'm not gonna show you what I have in Brooklyn because I think you belong in Severna Park, or vice versa. That's steering, and it's illegal. And so who can steer? An owner of a house that's seeking to rent it or sell it. A real estate agent, realtor broker, they can also steer, and the law applies to them too. Redlining, this is the practice of denying folks access to loans or insurance in certain communities because of their protected characteristics. Redlining maps that were developed 100 years ago are still governing the way real estate transactions happen in the United States. They still hold significant sway, and understand that redlining is 100% illegal. But if you look at the redlining maps that were created 100 years ago to determine where lending would happen, and you look where communities are situated now, you are going to see that it looks just like the redlining maps. Blockbusting is another biggie. This one is particularly nefarious. And so it's capitalizing on racism. Blockbusting is when a realtor goes into a neighborhood and creates a panic and says, the Hispanic people are moving in, or, you know, the Asian people are moving in. And so they encourage the people who own homes in that neighborhood to sell their homes at rock bottom prices to get out because they think that they're at risk of their property losing value. And then the same realtors will turn around and sell those homes at inflated prices to the people. Right, it's bad, it's bad. All right. So next slide, please. An emerging issue is appraisal bias. You might be hearing a lot about this in the news. It's assigning lower value to a home because of the race of the person who lives there. And I have a little trailer that I'm going to share with you. There's a video. It's a quick trailer about appraisal bias. This film is Our America Lowballed. Thank you.
Then I went through the work of whitewashing my home, removing everything that represented me, family, my culture, everything. And then in a couple days, I got the appraisal report back. I was right. The only thing bringing down the value of my home was me.
The story of awesome. You're all across the world, a light will do a bathroom, get rid of our hair product, all of our books. And just literally like, okay, did we miss something? We had a conversation with one. She's like, no problem, I'll be Tanisha.
So it paid for 1.482.
Almost one.
How that happened?
It's one of those stories that you start looking into and it just balloons and becomes bigger and bigger.
I think what we're seeing out of this problem is extremely widespread.
Goes to such ridiculous lengths to be
We found that homes in Black neighborhoods are underpriced by about $48,000 per home. This is happening all over the United States, robbing families of the money people use to live the American dream.
We're gonna put the entire appraisal industry under the microscope. We're being discriminated when the property is being appraised.
And these stories are shocking. And they are evidence that systemic change is urgently needed.
The system itself is so broken. Your home is valued for $25,000 less than 2 doors down from you. How does that happen to the HUD secretary?
No, because not what you call regulation. That's not, of course, what you call fairness. We paraphrase, if I can remind you. Treat it this way.
Thank you. So if you haven't seen that documentary yet, I'm gonna highly recommend that you watch it. It still gives me the tingles. The idea, there's that woman who said in the beginning, the only thing bringing down the value of my home is me. And I just don't know psychically how you even get past that. And so as we talk about.
Versus Honda Civic.
As we talk about fair housing and health, discrimination, there's sort of a direct toll that discrimination and poverty take on people in terms of the lack of resources, the exposure to unsafe environments. But there is the deep, immeasurable psychological toll that it takes as well. Because I think despite anyone's best efforts, it's hard not to feel like you're somehow defective. And the place where this should not be happening is in a real estate transaction. It just shouldn't. So that said, next slide, please. I'd like to highlight that we are having a homeownership resource fair in partnership with ACDS. It's going to be on April 22nd at Van Bocklin Elementary School. There are going to be some amazing classes about homeownership. It's how to get in your house. It's what you do now that the market is tough and you have a little money, but maybe not enough. What do you do now? It's how do I stay in my house? ACDS has a long history of providing this type of education in the county. And so they're very much looking forward to folks coming out. It's for everyone. Some of our elected officials will be there talking about housing policy. And so we invite you all to share and attend. Next slide, please. Finally, for more resources, or if you have complaints, this is your contact information. That first number is actually my phone number. It really is in fact my phone number. It's not fake. And so, call us if you need us. And thank you. It was my pleasure to be here with you.
Thank you so much, Asha, for a fantastic presentation, just highlighting health and home. And we're going to continue that conversation with our next presentation. Excited to introduce Charlotte Wallace. She's been a nurse for almost 30 years. Throughout her 20 years at Luminous Health, Charlotte implemented numerous programs, including a nationally recognized environmental health program, and most recently launched one of the nation's first mobile COVID vaccine clinics to our most vulnerable neighbors. Charlotte joined Anne Arundel County Department of Health in October and is excited to help build and launch their new childhood asthma and lead environmental case management program. We're so glad to have you, Charlotte.
Thank you. Honored to be here with you all. You can move to the next slide. So as mentioned earlier, our county has a new program that I'm excited to share with you. It's our childhood asthma and lead environmental case management. And lovely to follow right after you since we're in the homes. We're in many homes today. I'm very casually dressed, and there's a direct link, right, between, that's why it's environmental case management, directly between the housing condition and the children's health. Next slide. So Americans on average spend approximately, yep, you don't get to guess, the answer's there. And Americans on average spend approximately 93% of their time indoors, right? So the quality of the home, if there's mold in the home, there's smokers in the home, right? The quality of the home makes a difference. You move the next slide. So before I talk about the actual program, I just want to ground us a smidge on lead and then on asthma. So lead is a neurotoxin. So what part of our body does that impact the most? Right, awesome, right, our brain. So it lowers the IQ. It's things such as like difficulty concentrating, memory issues, attention deficit, a whole long list. Also behavioral. So it's things like aggression, irritability. There's often no symptoms. So parents are very shocked. They're like, our doctor told us we had to get it, or the daycare mandated us this test. And what are you talking about? There's often no symptoms. Unfortunately, when there's symptoms, it's very high and it's very dangerous. Then the impacts are permanent, unfortunately. There's medicine, say if it's ADD to help with that, right? But we can't reverse what's already occurred. So what we can help do is find the source of the exposure and stop it and eliminate and stop from further impairment. And then the next one, it's 100% preventable, right? This is not passed on from generation. It's not passed on from your grandparent or parent to child. It's their environment. And it's completely preventable. So what we need is all of our children tested. You go to the next slide. Oh, let me go back. Sorry, I forgot we moved that. I only had 10 minutes, so I took a couple slides out. And in Anne Arundel County, we are improving on our lead, and we are dropping slowly with national and with the state what the threshold would be. You can move to we'll go to asthma. Yeah. So asthma, as many of you I'm sure are unfortunately familiar. Asthma is respiratory, right? So our lungs. And the easiest way to think of it is that our lungs are, when you have asthma, are very sensitive, right? To an environmental, we call them triggers, right? Environmental exposure often. It's very serious. It's there's 197 children that die in the US each year because of asthma. It's chronic, which means it's not acute, right? I can take an antibiotic and go over it. It's not, right? It's chronic. They have it lifelong. You don't outgrow it, although that's a big myth when people think. It's the number 3 reason for pediatric hospital admissions, and the number 1 reason for chronic disease related for school absenteeism, which our big goal is to keep the children in school, right? We want them to go out for their sports or for theater, or for arts, right? To live their full potential. And so unfortunately, sometimes their environment, like these programs, we hope to reduce these exposures to let them live their best life. Yep, next slide. So the program, and I'm sorry about asthma, is I took away the disparity, and I want to make sure I mentioned it. Here in Anne Arundel County, just our data for Anne Arundel County, Black children are twice as likely for ER admissions related to their asthma for all other race and ethnic groups combined. So it's a huge disparity. Our data is already showing that disparity, and it's a huge focus of ours to work on that, to flip that. So we have 3 areas that we focus on: clinical, population health, and healthy homes. And for this group, I'm going to turn our cylinder of healthy homes over. You can do the next slide. So what we focus on is when we're in the homes, there's a basic assessment of the home that's directly related to the asthma or lead, but also a larger assessment. We're looking for smoke detectors. We're looking for medications that are left out while there's a toddler around, things for safety of the home. We have resources to help connect sometimes as well. Prevention that ties in with the assessment for risks and safety. And then, as I mentioned, resources. Okay, sorry, you can, next slide. Yep, so eligibility of the program for lead, they need to have lead poisoning, which at this point nationally is at 3.5. For the state of Maryland, we'll be transitioning in January to that number. So currently, if the child is 3.5 to 4.9, we will do the education and the case management, working with the family. When they're 5 or greater, that's when we'll go into home with the MD inspectors, look for the lead. They'll bring out samples if they need to test and work with the family closer. They live in our county for our services, and it's for all children under the age of 19. And it's asterisk there because the program prior, it was only up to the age of 6, which unfortunately is difficult. When they turn 6, they would close the case. Happy birthday, your case is closed. So we've been able to actually open up 2 cases in particular where the number was in the teens and 1 in the 20, because we can move up to age 19 over the child. For asthma, moderate severe asthma or asthma-like symptoms, we can work with the family. They need to live in our county. and all children up to the age of 19. Yep, thank you. So there is a subgroup within our program, and these are children that are enrolled in medical assistance or eligible for medical assistance, and we're able to give them durables. So things like a HEPA vacuum or the really good filtration system, and that way it captures a really small particulate matter. Cleaning supplies like a microfiber mop, pest control, which we need to reorder because we're going through it faster than we realized when we did our first order. So things like roach traps, mouse traps, medical supplies, pillow and mattress encasement, right, for dust mites. And then for lead, similar, we can do the vacuum and the cleaning supplies. And we do also screen for possible lead abatement if the family needs it, which would be free. Yep, and so referrals are pretty simple. There is a paper form, hopefully soon, maybe online form, but you can just simply call or email me, give me anyone can refer. You can just simply call and contact us, give us the parents' information, the phone number, and then we can take it from there. So it's very simple. That's the old deadline for some of you that have the information from the past. I do have my card, and I do have handouts if anyone wants. It's about, as often they're tenants and they're afraid of the landlord, but they're their rights. And we do have, for those medical assistance connection for free legal counsel if they need it. But I give some guidelines regarding that specifically.
Thank you so much, Charlotte.
Yeah.
We certainly want to honor your time, and I know that we're about 10 minutes before we close at 4. So I do want to pause here and just say that if you have questions or comments, feel free to email us at healthequity@aacounty.org. Of course, we still would like your feedback, your comments in the chat feature. So in case we don't get to all of your questions or comments today, we certainly will reach out to our presenters to get responses to any questions or comments that you may have. I'd like to introduce our next presenter, Mindy Garrett. She's a health policy analyst for the Anne Arundel County Department of Health, and she works as the coordinator for the local health improvement coalition, Healthy Anne Arundel. Mindy has a bachelor's degree in nutrition science and a master of public health from Purdue Global. She has a certificate in health education as a specialist, and she has a background in physical education, including being a group fitness instructor and a certified personal trainer. We're so glad to have Mindy joining us today. She's passionate about nutrition.
I really am. I feel like I was born to be in Healthy Anne Arundel. So the Healthy Anne Arundel Coalition, you can go ahead to the next slide, please. It is, as in your introduction, the local health improvement coalition for Anne Arundel County. The mission is to improve the health and wellness of all county residents. We do this by bringing together the different sectors of the community. Ultimately, we want a diverse group of people to have all the different voices at the table. And these are just some examples: schools, churches, business, government agencies, community members, and community associations. Next slide. So back one. That's fine. So the coalition currently has 2 active work groups. The first one I'm going to tell you about is the Healthy Eating Active Living work group. The goal promoting positive lifestyle habits, so including food and nutrition, and healthy activities and exercise. What we are working on right now is developing a database that could be used by residents and providers alike, that would just have resources available throughout the county. My ask to this group is, if you have a program or a service, or you know of a program or a service, my contact information is here, and I would like to know about it so that we can add this to our database. Last week and a half ago, we had Healthy Anne Arundel Day declared by the county executive. There were 25 activities, events held throughout the county, just celebrating what you can do in the county to keep yourself healthy. Lots of things from, I just lost my word.
Nutrition classes.
Nutrition classes, thank you. Giant Food provided some nutrition classes, some cooking classes, virtual, and some health clubs throughout the county had special events. Also, there were a lot of events at the local parks. So looking forward to that again next year. And then this group is going to be having a planning retreat next month. The date is May 18th. And we would love for anyone who is interested in helping out to join us at this retreat. We want to have, like I said, everyone's voice at the table. Tell us what you know or what you would like to see in Anne Arundel County to improve health on healthy eating, active living. And next slide. So the other work group is focused on mental health and wellness. The goal of improving mental wellness for all in the county. The main focus of this work group has been promoting a database of mental health providers and resources. This is called the Network of Care, and we are working closely with the Mental Health Agency on promoting that. And that is a program that can be used by residents and providers alike. Next month is Mental Health Awareness Month for the month of May. And I have the next slide that I go to, we'll talk a little bit more about that. But I also want to let you know about the planning retreat that we have coming up in June 14th at Quiet Waters. Again, if you're interested in joining the mental health and wellness work group, we would love to have you. Next slide. So for Mental Health Awareness Month, we have a campaign, and we are calling it Be Green and Be Seen. So the color representing mental health awareness is green. And we're asking people to contribute to this campaign by taking a selfie and sending it in and telling us how you embrace your mental health. And you can do that. You can find how to do that by going to our Mental Health Awareness Month landing page. Find it on aahealth.org and just searching Mental Health Awareness Month. And that on that page, you'll see the link to the Network of Care that I just told you about, all the events that are coming up that are focused around mental health awareness. There are several, there's a few examples here on the screen, but there are several community health fairs and a lot of things that are population focused, like this Dungeons and Dragons mental health. So a lot of fun things for everybody, a lot of family events. And if you go to that landing page, you can also click the link to submit your photo and participate in the big Be Green, Be Seen. Not necessary to wear green, it's just fun. Next page. So this is a little bit more about that campaign. Tell us how you embrace your mental health. There's a QR code. If you can scan that, that'll also take you to the landing page. And you can also go to the healthyannearundel.org website and learn about the events that we have going on throughout the year. So I think there's one more slide. And this is the calendar. So lots of events happening in April. If your organization is holding an event that you think would be relevant for Healthy Anne Arundel, I'm happy to look at that and see about adding it to the calendar. And the website is at the top, healthyannearundel.org. And That's the end. I think I made it under time.
Thank you so much, Wendy. So rather than reading to you the call to action items, I would like to perhaps take one question or comment from any of you here in the room, or perhaps if you're joining us online, if you have a comment or question that you'd like to share at this time.
We can do the room first, if anybody in the room got anything.
For anything, right?
Yeah, for, yeah,
So the ACDS, is that for the community or does it have to just be anybody here that?
Oh, no, it's for the community at large. It's anybody.
So if we're out doing our ambassador stuff, we're able to say.
Oh, yes.
Okay.
And in fact, that is the hope.
Okay.
So
Yeah.
please invite people and encourage people to attend.
thank you. That was a fantastic comment question. Appreciate it.
And in the chat, we had 2 requests for you. One person said, could you please send out the flyer that you was talking about?
For the expo,
Yes, ma'am.
we will send the
You'll send it out? Yes,
presentation,
ma'am.
yes, and it has a link where you can reserve your spot for this fantastic event.
Yes, ma'am. And any more questions, or we done?
You can
Okay,
share
now,
that.
it's just 2 more questions. One question says, about the citizenship, do undocumented immigrants have access to buy a house? I don't know if that goes along with the presentation or not.
So it does go along with the presentation. That's an interesting question. I think it depends, I don't think that I could give a straight answer to that, right? Because I think the question is like, how is the house being financed? Where is it being purchased? And so if you're going through the bank, I think if you're undocumented, you might have a challenge just because of the nature of banking laws and the tracking of the money that's done. But that's probably a good question for an attorney that does immigration related work or housing related work in terms of purchase.
And one last question, this is for the health equity team. It says, how does the health department describe the word vulnerable?
A great question.
How's the county define vulnerable?
Well, so there's not one definition, just like there's not one definition for health equity. But I think in terms of vulnerable, it's those populations where we know, just based on the data that we're seeing, that the community is, like Asha mentioned earlier, and like some of our presenters highlighted, they have needs related to being under-resourced, whether economically, access to education is limited, quality education is limited. And so when you are looking at those type of communities where the social determinant of health needs are the greatest, those are the communities where we want to really target our resources and equip those communities with the resources, the relationships that they need to achieve their best health. Fantastic question. Anyone else would like to add to that? All right. Well, thank you. I'm so glad we had time for questions and comments. Again, feel sure. Yeah, go
I'll
ahead.
just do one quick promo reminder
Yeah.
about our gun lock pilot. I know you all probably remember Siobhan Wilson, who presented here a couple of months ago. I'm like, what month is it? But we have a wonderful pilot happening right now in 3 of our local libraries, in Eastport, in Annapolis Bush Library, and in Glen Burnie Library, where residents can come in and get free gun locks. Very easy to do, and there's been quite a lot of media coverage around it. We just started this last Thursday, yeah, and in 4 days, we've already given away over 500. So it's being very well received, but we would love to see, we'd love to run out. So that we have to buy more. And we know that you all are so fantastic at getting the word out. So please, by all means, help us get the word out to make sure that residents can take advantage of this opportunity and get gun locks for free. Thank you.
I have a question based on that. Where do they, like, if you're not in Annapolis and you're in the Severn area, how do we get?
They'll transfer. So the pilot libraries do have the ability, just like they transfer books for residents, they have to transfer the gun locks upon request. We're hoping to expand this too. Right now, it's, we're testing this out. So that's why we just chose the 3 libraries to get us up and running. But if we see a high demand in other areas, then, we hope that that's the future for us to be able to distribute even more in the county.
Thank you very much.
I don't want to steal Dr. Ginn's thunder. Do you want to add anything to that? Okay. Such a great job talking about it.
that we are collecting zip codes, so hopefully if we're seeing a lot of residents from a different part of the county than where the library is located, we can target that. And we are using our gun violence data to drive which libraries were initially selected. So of course, there are more neighborhoods that are impacted that we'd like to get to, as Donna mentioned, this is a pilot, so we're hoping to work out the kinks and then with our wonderful partnership with the library. It's been fantastic, so we look forward to it.
And we may have some library representatives on the call. So yeah, thank you. We appreciate partnering with you. Well, thank you all for joining this month's Health Equity Forum. We hope that you'll come back and join us next month as we focus on mental health awareness. Take care. Thank you. Thank you. Thank you all.
There you are for your.
The box.
Yeah.
Oh, are you?
I saw that.
Yeah.
You said it, I was like.
It's a pleasure. Yes. And they're gonna Housing Expo.
No.
And then I think there's like.
I think the conclusion was.